A warm welcome to the Talking Cure podcast, where we talk all things mental health. And today we're going to really break it down and talk about the profession of psychology. I'm very excited to have one of a good friend and a colleague who is a clinical psychologist, Mme Bosao Monyamane, who is going to introduce herself in terms of who she is and what she does professionally. Mme Bosao, welcome.
Thank you, Mele. Thank you so much.
We're really happy to have you.
And thank you for having me.
The viewers will probably like to know who Mme Bosao is. So, who is Mme Bosao?
I am Bosao Monyamane. I am a wife, I'm a mother, and I'm a clinical psychologist in private practice in Maseru.
Okay, Lovely to hear that. And like we said, today we're going to really break it down and get to know about the profession of psychology. But even before we jump in, we're in a mental health space. We always just check in. How are you arriving today? So how would you say you're doing emotionally, mentally, in many different areas? How are you arriving today?
I think I'm in a good space mentally. I feel recharged. I had an opportunity to rest. I think it contributed a lot to how I feel today. And yeah, I think just in a nutshell, I'm in a relaxed space.
That's
and I love
really
that.
good.
I really love that. It's very good for my work. It's good for my family. Yeah, I appreciate that.
Mm-hmm. Okay. I am wondering, in terms of how you ended up being in private practice in general. Because I'm thinking of your studies, I'm thinking of Lesotho. I know you've had an opportunity to live in different countries. How did you end up even in mental health in the first place?
That's actually quite interesting. The journey is quite interesting because I didn't even know a thing about psychology. And after my matric, I didn't go straight to university. Okay. So I did a bridging course. That's where I was introduced to psychology. And I found it to be such an easy subject to do. So I was doing psychology and sociology, and I was passing pretty well. So when I got to varsity, I continued to perform pretty well. And I thought, oh, so this is something that talks about the study of human behavior. And I really started falling in love with that. But coming back to your question pertaining to why private practice. For the longest time, I was working for an organization that provides counseling services for abused children. So I met up with a few doctors that I know around town who said the need is so high for mental health, particularly in private practice. Of course, in public as well.
Oh, yeah.
So I thought, okay, I mean, it was a bit intimidating because it means starting a business. So, but I must say they were so helpful in the journey. They were able to guide me and, some of the challenges were having to consider the financial impact as well.
Oh, yeah.
The implications. So, but I must say, maybe this is something I can encourage people. It's okay to go into private practice, but I think it's wonderful. I think you also did the same, that it would be good to have exposure elsewhere.
Yeah.
You know, it really builds a lot on the profession. By the time you start your own thing, you are in a much better space professionally in terms of growth as well.
Oh, yeah.
So, yeah. But as well as for business purposes as well. I went to school, I got trained. So I thought, start a business.
Exactly.
Yeah.
Why not? Why not? And for somebody who is wondering what you do in private practice as a clinical psychologist on a day-to-day basis, what does your work look like?
Private practice, we do mostly psychotherapy, individual psychotherapy. So maybe let me just define that so that the viewers can understand. It is a form of a treatment that uses talk. That's why sometimes they call it talk therapy.
Yeah.
It uses talk, it uses communication.
Hence the name of the podcast, The Talking Cure also.
Right. Yeah. That's right. So it uses talk between the therapist and the client in a way that the client is helped to identify unhealthy thoughts, unhealthy emotions, unhealthy behavior, but also really just equipping the client with constructive coping mechanisms. So we do that individual psychotherapy, group sessions as well, group psychotherapy, which in most cases would be when a group of people who have gone through a similar problem then are in need of psychotherapy. So you provide that as well. But we also do couples therapy. I'm sure that one is clear. Couples. We also do workplace wellness as well, to work with organizations as well. So with psychotherapy, you find that depending on the training that one has received, there are different therapeutic approaches. So you often use one that is relevant to the client or that will be able to help the client.
That is very important, and it's good just to understand, even just for Basotho or anyone listening, just to hear what the services you offer, what is it that they can come for. And I know people may be wondering, personally, when I introduce myself, I always say I'm a counseling psychologist, also in private practice. And I know people may be wondering what the difference is between a counseling psychologist and a clinical psychologist. And I know you did mention that there may be different areas or categories.
Other categories, that is very true. And I know this is one area where sometimes there's really just a thin line in terms of the definition or the differences, in terms of describing the differences. But for instance, if you look at in Southern Africa, maybe particularly where I got the training, both psychologists, clinical and counseling psychologists were in the same program when we do our coursework, but there were a number of subjects that would not include both categories. For instance, for clinical psychologists, we would have an additional subjects such as psychopharmacology, which is dealing with medication, and then also neuropsychology, which deals with the brain and the relationship between behavior and the brain. But with regard to counseling psychologists, then there would be career counseling.
In our context,
in your context, maybe you would talk better under that. But so that's where the differences would be. But you find that with regard to coursework, we're all in the same class. The other difference then would be when we do our internship. Then clinical psychologists usually would go to more clinical settings like hospitals, whereas counseling psychologists would go to maybe schools or university as well. Even with regard
student
to
counseling, centers,
counseling, to work with students, to work with students. So I think in a nutshell, I'll say the differences are just on the basis of that. But also, as you and I usually talk about it, the importance of understanding that there isn't any that is better than the other. Being a clinical psychologist is not better than being a counseling psychologist is not better than being a clinical psychologist. It all just depends on the scope of practice that the training that we've acquired. So we actually need one another.
We work as a multidisciplinary team, and I think it's very important for you to bring that up, Ebsa, because I think in our profession in particular, and I think in many different professions, sometimes even just in society, we sometimes think different is better. Whether it comes to race, whether it comes to gender, we just need to understand that we work together as a multidisciplinary team. Even though it's very important for each category to be able to remain in their scope of practice, because otherwise you can't be, for example, dealing with people in an area where you're not trained. Otherwise, you'll be doing more damage even when you think you're helping. So I know when you say that, you remind me, because I've experienced it. I don't know if you have felt or sensed it. I know sometimes, even just in our context, psychologists may think they're better than counselors or social workers. Psychiatrists may think they're better than just because they are medical doctors. But the reality is we are all different parts of the same body in terms of mental health. So we just need to be able to say, what is my role? What is my scope of practice? How do I become part of a multidisciplinary team and play my role perfectly and effectively? The challenge is when each of the different professionals within the mental health space now go beyond the scope of their practice.
Then the damage is caused.
Yeah. And I'm wondering, somebody may be interested in studying psychology as a student. Where does one start? I know we have a huge need in the Mountain Kingdom for psychologists in this country. Where does one start? I know the journey tends to be long, but I think for somebody who is listening and who is interested in the profession, what can they do and where can they start?
I think it's always important to do research about the profession you want to explore, the profession that you want to do. So it's good to learn a little bit about psychology in terms of the categories, the different categories. But if you are planning on studying in Southern Africa, then it's important for you to know that, be patient enough to know that you're going to be going to school for some time. Because what usually
and
happens
I think anywhere in the world, in the US, it's even
longer.
Exactly, and in
longer.
Europe,
Because after your first degree, so let me make reference to Southern Africa.
Yeah.
After your first degree, then you still have your second degree, which is your honors, and then you'll have your 2 years of masters. So I'm just saying sometimes people can feel so overwhelmed that it's such a long program to partake in. But the reality is, with just your first degree and your honors degree, really you have acquired nothing.
Yeah.
All you have is theory.
You don't even start practicing with your honors. You can't even be consulting and seeing clients. Yeah.
And I think sometimes people get weary when they complete their honors level, because there's yet another process into the master's program.
And the selection process
is so tough. It's so tough. A lot of people have lost hope. But if you're really determined and you really love to become a psychologist, if one varsity says no to you, the next one might say yes.
Oh, yeah.
And I would really encourage students who love to study psychology to explore that, to look into that, because the need is so high.
Oh, yes. Yes.
The need is so high. So I think starting with the research will help a lot, because even when you get to your master's level, it's still very important for you to understand that you're following a path or following a career path that you love. Can you imagine if you choose, I don't like to work in hospitals, and you choose clinical psychology?
Oh, yes.
And then you realize that wherever I get employed, I might find myself working in a hospital setup. Well, they're not limited to that exactly, because clinical psychologists can work in hospitals, they can work at the university, they can work for government agencies, they can work in private practice.
I was about to say they can be in private practice like you. Yeah.
As well. So I think they are not that limited, but it's always important for them to understand. Because I remember when I first explored doing clinical psychology, when I first discovered that I'll be working with, for instance, psychotic patients, people who hallucinate and are delusional, I thought, I don't need that.
Yeah.
Because in my understanding, I thought I am only going to be working in a hospital setting.
Yes.
So, but I work in private practice and I work with adaptive clients.
Yes, that is correct.
Who don't necessarily need...
That is correct.
Yeah, who don't need hospitalization.
I think I like it when you say clarity and educating ourselves, because then you go into a particular category knowing specifically. We've just talked about, for example, you will find a lot of people know about clinical psychology, and it becomes more attractive because of the title, for example. Yeah. And I remember being torn between doctors. Exactly in a clinical setting. And I remember being torn between deciding between clinical counseling. But I realized that I was more drawn towards counseling psychologist. I do a lot of work around employee assistance programs, for example, in organizations. I know when we talk about career counseling, we only think of students, but it's not necessarily the case. There's a lot of people who have been working for a long time and they want to reinvent themselves, or they find they are not happy in the career that they chose. And the nice thing is career is not as linear as it used to be back in the days. So you find ways to navigate. So, a bit of psychoeducation and doing research to get to know. So you said there's clinical psychologist, there's counseling psychologist,
there's
educational who work in school settings.
There's research,
there's
neuro,
there's
forensic as well.
There's forensic also. So you just need to be able to know the different categories.
And what is offered where you're going. Or
exactly. And the environment that you'll be working in, even though they may be different environments. Yes. And I'm wondering, we're talking about students now and probably somebody who would like to study psychology. Let's say somebody is now done. They're looking to come home. We want all Basotho psychologists out there. We really need help in the beautiful mountain kingdom. So if you know anyone who is in varsity, I know that Mme Bosao is part of the Psychological Peer Credential Society of Lesotho. What does one do once they are done in terms of registration? I know that we have the Lesotho Medical, Dental, and Pharmacy Council that normally we would register with when we come back home. Tell us more about the Psychological Society in terms of what it does. How can one be part of it? Just in general, as I've completed my studies, for example, how do I integrate back into the community and become part of the clinicians and the professionals in the space of mental health in Lesotho?
I think like any other profession where there's an association or a society, it's always important to belong somewhere where a regulatory body, where you'll be able to be accountable for the work you do and for you as a professional as well as for the services you offer.
Yeah.
So I think similarly our society does the same. It regulates the work that we do. It protects the public from ensuring that clinicians or mental health professionals are not causing harm.
Yes.
So it would be good to be a part of that.
Yeah.
And it would also be good because the society gives you an opportunity to get to know more work that is done within mental health. So you're not isolated.
Exactly.
You're not isolated. You've already mentioned the importance of registration with the Medical Council, because that's yet another regulatory body that ensures that all mental health professionals are being regulated and they're living within the standards that are expected.
Exactly.
So I think being under that umbrella really gets to expose you as well to the work that you can do.
Exactly. And I think when you talk about the different bodies being regulatory bodies to be able to standardize professions within any country, it's important. And I think for Basotho or anyone in any part of the world, just to be aware that it's important to check with the clinician that you're seeing. Are they qualified? You know, we always say you wouldn't just trust anyone. Let's say I'm going for a brain surgery. I wouldn't just go to anyone for them to perform that surgery. Or if somebody's been diagnosed with cancer, they would go to a specialist, an oncologist, to be able to deal with that.
Yeah.
So, but the challenge sometimes, and what we have experienced in our beautiful country, is that everyone tends to be a psychologist, and everyone tends to, you never know who you're going to. So it's our responsibility as individuals to be able to ask, Mme Bosao, are you a clinical psychologist? Are you a counseling psychologist? What does that even mean? What's your scope of practice? So that we know. And I always say it's important. And I guess this is a call also to all clinicians out there to be able to register also with the society, because if you're part of a body that is regulated, at least you know that, I can trust Mme Bosao. The council vouches for her. Therefore, I know that this is somebody. It doesn't mean that they may not be malpractice, because even professionals that are qualified sometimes may skip the line, the ethical line. So that is still very important. Yeah. So thank you so much, Mme Bosao, for that background and understanding in terms of the profession. I'm wondering now, in private practice, what kind of clients do you usually see? What has been the presentation in terms of the different diagnoses probably that you tend to see in your private practice? How has the experience been?
I think a lot of times we come across like your day-to-day stressors where people go through day-to-day challenges such as stress in relationships, bereavement,
Yeah.
divorce, excuse me, financial challenges, to the more severe mental health conditions where we end up making, like, diagnosing major depressive disorder, anxiety. These come across as quite major ones.
Yeah.
But for those that work with children as well, I'm no longer working with children, but we used to come
Basotho are not going to
across.
be happy to hear that, Mme.
But you tell them you do work with children. Mele was there to take care of your children. Yeah, because that's another biggest issue right now, dealing with neurodevelopmental challenges, children that suffer from autism, ADHD. So psychologists are there to provide help. Now, I know, maybe going back to the categories, my apologies for that, there's always this need coming from the public that, but I want to see a child psychologist.
Oh, yeah.
And if you say, I'm a clinical, no, I want to see and I'm like, I'm referring you to a counseling psychologist. No, I want to see a child psychologist. Within Southern Africa, there's no such a profession.
Yeah.
But if you go to the US, then you will find that. Where else other than the US?
I think Europe also.
Europe as well. But the people that are trained in Southern Africa are equipped enough to take care of these mental conditions that I've just mentioned.
Exactly.
So those are some of the issues that we will come across. So maybe when you look at depression and you look at the causes behind that, there's also, like, many other factors such as substance abuse within that. There's suicidality as well as a result of that. So there's just a lot that comes out of these conditions that I've mentioned.
Oh, yes. Yeah. So what you're saying, you caught my attention with child psychology there, because I've also experienced that a lot. And I think people don't understand that in our context in Southern Africa, and we'll make more reference because
That's
studied in, exactly. There isn't, when you look at the Health Profession Council of Lesotho, the Health Council, Profession Council of South Africa, the HPCSA, there is no particular category of child psychology. I know that there is one university, as far as I know, you're part of the alumni of the University of the Free State, offers clinical psychology, but at PhD level, also not in the practical setting, in the clinical setting, but research only. So we do not have that particular category. So no one is called a child psychology in the context of Southern Africa, but your clinical psychologist, your counseling psychologist, your educational psychologist, even neuro, will be able to see individuals of different ages, working with children, working with adults, and like you said, with couples, also with elderly people, dealing with dementia, Alzheimer's, and other mental health related at that particular age. Even though, of course, like you said, sometimes it's just a matter of preference. There are some clinicians that will say, I only see children from this age to the certain age. I know some who will say, I currently don't see couples, or others will say, I do. So make sure that you inquire and get to know what your clinician provides even before you go, so that you're informed and be able to make an informed decision. And this brings me to think about the relationship. I know sometimes someone may be thinking, do I go to see Mme Bosao? Do I go to see Melebu? We have quite a number of psychologists, for example, even just within the Psychological Society. There's Mempeng Tamai, there's Mempora Mahata, there's quite a number of clinicians, and somebody may be asking, who do I go to see? How do I get to choose and decide on which psychologist to see? I know it's about relationship, I know it's about connection. How does one really decide in terms of who do I go to see?
I think the most important thing, knowing that you're going to see a psychologist, is important. But when you go for, some psychologists will make it available if they have social platforms to indicate the type of work they do. So maybe that helps. But in some instances, then you might have to have your first session. And in the first session, and I think it helps if you do first session, because you're not talking to the internet where you're just reading. You're actually connecting with the person to say, do I like her? And we're not offended if you don't come back.
Definitely.
If you felt I don't resonate with this person. And it's also okay for us to share with the public or your client the type of therapeutic approaches that you deal with. And in this case, because people are educated now, people read about these things. A lot of times people will tell you, do you do CBT? I'm like, what is CBT? Do you even know CBT? So I think
what
that
is
helps
CBT,
a lot.
by the way?
CBT is cognitive behavior therapy.
Yes.
So, but the fact that they read, it says a lot, so it's important for you to provide what the client needs. So if after the first session you realize that we don't get offended, but I would rather say go to a place where you get help.
Yeah.
It's just that another pattern that we've picked up is clients know that there are quite a number of psychologists available. So if they feel maybe the work that is offered, not in terms of resonating, but in terms of, I don't like the things that this person is saying, because now they are touching on sensitive areas.
Yeah.
Then I'll go see Mele. Mele, we're saying the same thing. Then I'll jump, I go see. So sometimes you pick that. And I just want to say it's unhealthy for you as a client if you end up doing that. So it's not that you're forced to staying with a person, especially someone who's unethical. No, you shouldn't. But if you know that it's you, the client, who needs to deal with things, then maybe think about that.
Therapy is not an easy process.
No, it isn't.
It brings out a whole lot of emotions that sometimes is very difficult. And I even say sometimes, and it's okay for clients sometimes to take a step back when you realize it's too heavy. Much. But the reason you're in therapy is because your clinician is there to be able to hold your hand.
To contain you.
And walk the journey with you. So that is very important. But if you're with a good clinician and there's good clinicians around, regardless of where you go, you'll still find the same response because the plan is for them to be able to help you. But I like the emphasis also on making sure that you have a good relationship. I mean, like any other relationship, usually a relationship grows and forms because there's connection, people click. So I think it's the same thing that happens also with a clinician. You have a good therapeutic relationship. I know that sometimes I've come across people who will say, Melebu, I want to come see you because I know you. And I'm always like, unfortunately, for ethical reasons, I'm not able to see you. I always divide my clients in 3 categories. The people that I know that are friends and family members, the people that I do not know and I can consult with and see immediately. And then there's this tricky category, especially in our beautiful mountain kingdom where we all know each other and we're all related to each other. The people that you know, but you
don't really know.
Exactly. And I know we always have to be very careful how we navigate that space. What would you say to somebody who would say, yes, I want to see you because you know me and I know you and I already feel safe with you. Please don't refer me to anybody else because I want to see you. And I know ethically.
Yeah. I mean, and we hear that a lot in therapy.
Yeah.
And I think I understand where clients come from because you want to be in a safe space with someone that you already know, so you feel more comfortable. But as a result of ethical obligations, there's just nowhere you can see someone that you know for reasons such as it's very difficult for you to become objective in that space.
Yes.
You know, there are things that you would probably have said subjectively to this person. For instance, quit that job or leave that relationship. But I can't tell the client to do that. So this one, I'm more subjective because I'm thinking about what you're going through. Why are you putting yourself through this?
Yeah.
And
that is now you.
That is me
as
now
an individual coming in.
Exactly.
Yeah.
So they never understand that. So sometimes it brings such disappointment to them. But because I want to protect this person and I'm more concerned about their mental well-being, I'll say no.
Yeah.
Go see Melebu because Melebu doesn't know you.
There won't be any biases.
And I know sometimes they talk about us because they say, you keep moving us around because you say we know you. Yes, we are protecting you.
Yes, yes. Yeah. And I think it's also important for us just to be aware that we're also human beings, that we can be biased because we are normal human beings. That is why in some instances, you will find it's very difficult to even see different clients from the same family. Exactly. Because once you have had an experience and an introduction to that family through one member, that's their perspective.
Yeah.
When another client comes, you're
And it
already
clouds-
contaminated. Exactly. It clouds your judgment and seeing that client for who they are.
Yeah.
So I think it's important for clients to fully understand that and know that, like you're saying, we're doing that to protect them. And that the therapeutic relationship has to remain a therapeutic relationship. Once we start therapeutic relationship, we can't have any other relationship outside that context. So that is very important to be mindful of. Yes, Mebsa. Tell me now, just generally in terms of Basotho, whether our community in general or in the workplace, how do you think Black people or Basotho are receiving mental health in general? Is there understanding? Are they open to it? Do we still say it's uncultural to go see a psychologist? There's still a lot of stigma around the work that we do, even though I know there's a lot of people who go out there and they are really advocates for mental health. In your context, what has been your experience of how Basotho see mental health in general?
I think from the time that I started working as a psychologist, this would be
Which
around
was?
2010.
I'm interested.
Maybe.
Yeah, I know it's been a while.
2010. I know at the time there was still a lot of stigma around it, and people would say, psychology. So does this mean you're working with people in Mohlomi? And then once you raise the name Mohlomi, people just think,
Which is our
I'm
psychiatric
not crazy, which is our
hospital.
psychiatric hospital. No, I'm not crazy. So we've been dealing with that a lot back then. But with time, people have started to warm up towards the profession, which I think is really wonderful. Like I said earlier, that people start reading now. They watch podcasts, they read materials. They'll tell you, I was listening to this psychologist talking about this and that. So you're starting to see that a lot, that people are starting to warm up to the profession, which I think is a good thing. The only thing that maybe is still a challenge is access to the services, whether public or private. Because in private practice, it means at least you should have the financial muscles to be able to come. People keep saying, why are you expensive people? I don't know, we're like specialists, aren't we?
That is correct. And I know compared to other countries, for example, people that have trained equal, like if I know, for example, the financial muscle of Basotho will never be the same as in South Africa. But I would say the fees that are charged in Lesotho are still
affordable.
Exactly.
They're still affordable
compared to And I think sometimes maybe clients may not be aware of the work that goes into even after the therapy session, the formulation, the work that goes into that. So it's very important. But I fully understand what you're saying. And I remember, I think it's about 2-3 years, the theme around mental health has always been around access. How do we make sure that, mental health services become almost like a right for every human being? Because people are going through a lot, especially since COVID. There's a lot of stuff around mental health that have started bubbling up that were exacerbated by the environment at that point in time. Other than we've always been dealing with mental health issues, whether it's the stresses at home, at work, or in any environment. So access is very important for every person to be able to have access. But we know that it's not always the case, and the services or access may be limited in our country. But we hope that platforms like this, it's a way, and that's why we started the Talking Cure podcast, to be able to psychoeducate Basotho, to be able to start normalizing mental health, to be able to have an opportunity where we can call other psychologists or people that are still in school finishing up, knowing that we need help in the context of mental health in Lesotho. So let's have as many professionals as possible so that we can be able to have mental health access in Lesotho. I know the Psychological Society, the Psychological Peer Credential Society of Lesotho, your motto is mental health for Basotho. So we want access for every Mosotho to be able to have mental health services.
And at this stage, all of us, almost all of us, are based in one district. So what does that say about the rest of the district? So we need more students to qualify so that we have more psychologists, more people will have access to the services. Yeah.
That is very important. Yes. What would be your parting message as we wrap up to Basotho when you think about mental health access, when you think about mental health in general? What message would you like to leave with Basotho in relation to mental health in general?
I think for the longest time, we spoke about stigma around mental health. People would always believe that seeking professional help is a sign of a weakness, but actually is a sign of saying, I am prioritizing myself. Yes. I am taking care of me. So I'm taking care of me so I can be a better parent, a better teacher, so in other words, with all levels, family level, community level, national level. So it really just brings a lot of good results in that regard. So I will say my mental health is my priority.
Oh, yes. Yeah. I like that. Yeah. My mental health is my priority. And I'm taking that message also for us. I have a colleague who usually says jokingly, even though it's so true, that I don't trust any psychologist who's not in therapy. Yeah. So that also goes for us because we're also human beings. So it's very important to make sure that we all take care of our mental health. Yeah. Thank you so much, Mme Bosao. With those words, my mental health is my priority. Would like to say thank you. And thank you for your patience. I know it's been a while since we had published one of the podcasts. We appreciate your patience. We've had a few challenges, but we are excited and we are back now and we are continue with the Talking Cure. In a very special way, we would like to thank MS Catering and Decor for the beautiful table that you see here that they sponsored us with. And also would like to thank Ndade Tukiso Ntebe from TKO Consultancy, who has been our mentor in this podcast social media space. And even when we have had challenges, I know he always says, Melebo, this is bigger than us. We just have to keep on keeping on. So with those words from me, Lebohang Maskhonyana Bereng, would like to say thank you. Please subscribe, share, because you never know who will need this message and who will get help from this podcast. And until we see you next time in our next episode, take care of your mental health. Thank you.